All right, hi guys. How's everybody doing? Happy Monday. Hope you all had a really good weekend. We're going to jump right in today and get into chapter 4. If it seems like a lot of information, don't be overwhelmed. It's okay. This will all start to make sense a little bit more as we actually get into the skills assessment. So everything you are actually learning on your lectures right now, you will also learn through your skills assessments when we get into it later on in October. Okay, just as a reminder, make sure you guys are working on your quizzes and make sure you are actually going through and reading the chapters. It has a lot of great information and has a lot of charts in there set up to help you go through things and memorize things a little bit easier. Okay, so we are jumping right into chapter 4, and today we're doing obviously chapter 4, so we're going to do things that help us to find out what is actually wrong in the situation and how to go about it. Okay, so first we've got the assessment steps. Obviously, we know we need to size up the scene. Remember, that's what we were talking about in our last lecture. Okay, then we're going to need to perform a primary check. Then we need to perform a physical exam and then attain a person's sample history. So make sure you know these 4 steps right here because this is going to be the order that you are going to need to perform things in. Okay, so if we're looking back at the size up the scene, remember we are looking at the scene, we're looking to see if there are hazards, and we want to be aware of the potential for violence, observant for weapons. If the scene is hazardous to us, obviously, as the first responder, and we do not want to go in, we want to make sure we reduce our exposures to harmful things, and it also allows us to help determine whether the person, or whether the problem, I'm sorry, is an injury or an illness to the person. Okay, after we have done the size up of the scene, remember we do that 10-second size up and we decide that we do want to help and we're going to go into the scene and we're going to approach the individual. Next, we would go up to a primary check. Okay, so after you size up the scene, you are going to do a primary check. Okay, so you have to form a first impression of what is going on. Does it look like this is an injury or an illness? Is the person responsive or unresponsive? Okay, I will go into what we do in that area. Just hold on one second. Let me get through this slide. Are they breathing adequately, talking? Do you notice any bleeding? Is there exposure to blood or bodily fluids? Is there also danger to you, to the injured or ill person, or any bystanders? Okay, so we're going to go to checking for responsiveness. Okay, you're obviously going to need to know whether the person is responsive or not. If you notice that the person is not responsive and you go up to them, if you believe that they're unresponsive, you're going to go up to them, you're going to tap them on the shoulder, and you're going to ask if they are okay. If there is no response whatsoever from that person and you notice that they are unresponsive, you need to immediately call 911. Okay, if you cannot detect breathing, this is when you would begin CPR. So how we would detect breathing, obviously we would look at the person's chest and notice if it rises and falls. You can also try to feel for the breath with your hand. And then if we do notice that they are unresponsive and they're not breathing, we immediately need to start CPR with those 30 chest compressions and 2 breaths for 1 second each. We will go more into what CPR actually entails in the next chapter, in chapter 5. Okay, so this is what we're doing when we check for responsiveness. We're going to ask the person if they are okay or not. If they are unresponsive, then we immediately need to call 911. And then this is when we are checking for breathing and determining whether we need to do CPR or not. Other ways to check for breathing, okay, like I said, we're looking at the chest movement, whether the chest rises and falls with each breath. Okay, you can listen for normal and abnormal breath sounds. Okay, wheezing, something that sounds like snoring, something that even sounds like choking. Those are all signs that someone might not be breathing properly. Okay, cyanosis and skin color. Cyanosis is whether the skin looks a little bit blue, the lips, whether your skin is grayish tone or pale gray tone. All these can indicate whether there is a breathing problem. Okay. For going next, we're going to check for severe bleeding in an individual. Okay. We're going to check for a large amount of blood. Most of the times you probably will not encounter severe bleeding. It is pretty rare. However, if it is severe, then we know that we need to take care of that. Okay, so we're going to look for blood pooling around the person, on the person's clothing. If it is severe severe bleeding, we know that this is life-threatening, so we need to control the bleeding. So we need to put a sterile cloth on the wound, and we need to make sure that we hold it to control the bleeding. This is when you would also want to wear exam gloves as well to protect yourself. Okay. Another Another portion of the physical exam is to determine whether the cause of injury was significant. Okay. What we mean by that is if this is a serious injury. Okay. So we have to assume a person with a head injury also has a spinal injury. Okay. You can check for, does my next slide, hold on a second, have how to check for a spinal injury? No, okay. If we were to assume that somebody has a spinal injury and the person is alert, there are several ways that we can check for this spinal injury, okay? You're going to want to hold the person's hand, okay? But you're gonna ask the person to turn away so they cannot see you holding their hand, all right? You can press on each finger. Okay, you can also do this on the toes as well. Okay, you should be doing it on the hands and the toes actually. And you can ask that individual if they feel that you pushing on their fingers, if you feel them squeezing the fingers. Okay, you can also ask them which finger it is. You can also ask them to wiggle their fingers and toes. Okay, and you can ask them to squeeze your hand or to push their foot against your hand as well. If you notice that they cannot do anything along those lines, then you need to understand that yes, this person maybe has a spinal injury. If you assume that they do have a spinal injury, then you need to stabilize them and not allow them to move. Okay, so you're going to have to instruct them not to move. Okay, because a spinal injury or head injury, something of that is very serious. Okay, and the more movement that they have, the more they could injure themselves. Okay, for a responsive person, like we just talked about, you can ask to wiggle fingers and toes and everything that I just talked about. Okay, for an unresponsive person, if you suspect a spinal injury, you're not going to move the person's head or neck. Okay, you'll want to make sure you keep those straight. This is when a situation that arises that you would not be moving this person until EMS does arrive. Okay, you're going to assess a person's entire body. Okay, so you're looking for signs and symptoms that can tell you what is wrong with the individual, whether they're sick, they're injured. So signs, conditions that you can actually see, feel, hear, and smell. For symptoms, these are things that a person can feel and is able to describe to you. So most people will have a chief complaint. Okay, so let's pretend somebody broke their leg. That will be the chief complaint. So most of the times you will just be helping that individual with that chief complaint. Okay, so in your physical exam, you're going to hear the acronym DOTS many times. Okay, so you need to understand that the D stands for deformity. Okay, O is for open wounds, T is for tenderness, and S is for swelling. Okay, so you have all of these pictures right here. Okay, so we can see here that maybe this person dislocated their elbow. So for deformity, this is an open wound, whether it be gushing blood or there's some other type of fluid. Tenderness, I'll describe that to you when you're going to go through and check individuals' extremities and squeezing areas, whether that area is tender. They could have an internal injury, they could have broken bone, something along those lines. Or we're looking for things like swelling. Like you can see the lateral side of this individual's ankle is swollen, indicating that they may have broken their ankle or torn ligaments, something of that nature. Okay, so significant cause of injury. If you notice a significant cause of injury, you're going to look at the head. Okay, so you are going to go back to this DOTS acronym here, and you're going to look for deformities, open wounds, tenderness, swelling. Okay, so you're going to be looking at the head first. When we do a body scan, we're always going to start at the head and move to the toes. Okay, so always starting at the head. Okay, then we're going to check the eyes. Okay, when we're looking at the eyes, we want to make sure that we were looking at the pupils. Okay, individuals should have the same size pupils. All right, if you notice that maybe one pupil is smaller than the other, then this could indicate a brain injury or a stroke, which is obviously very, very serious. If you have a flashlight, you can use a flashlight to see if pupils react to the light. If you do not have a flashlight, okay, you can always cover one of the eyes with your hand for a few seconds. Then when you move it away within a normal person, within about a second, the eye pupil will restrict again. Okay. After you check the eyes, you're going to look at the ears and nose. Okay, you want to make sure that you look to see if there's any blood, clear fluids coming from the ears or nose. Then you are also going to check the mouth. Okay, you're going to look for swelling around the mouth. Things you can look inside the mouth to see if there's objects, chewing gum, anything along that could indicate choking, or even things like vomit. You can also look for things like broken teeth. So you're going to need to also look in their mouth. So let's remember, first head, then we check the eyes, then we check the ears and nose, then we check the mouth. Now we're going to move to checking the neck. So you're going to go back to that DOTS acronym. Okay, so you're going to look for deformity, open wounds, tenderness, swelling. Okay, then we're going to go to chest. Okay, we're going to look at the chest. We're going to gently press on the sides of the chest by the rib cage here. Gently press inward. Okay, as you are doing this, make sure you let if the individual is obviously alert, make sure you let them know what you are doing. If they indicate that there is pain there, it could mean that they might have something along the lines of a rib fracture. Okay, then we're going to move to the abdomen. Okay, again, we're going to go for dots. Okay, so we are looking for the deformity, open wounds, tenderness, and swelling. All right, we're gently going to press on all four quadrants. So you are going to separate the abdomen into 4 different quadrants. You're going to test or press down, see if they gentle pressure in those areas, see if you can feel anything, or if they complain of any type of tenderness or pain in any of those areas. Then we're going to check the pelvis. So we're going around the hip area as you see here. You're gently going to place your hands on the outside and squeeze in, see if they have any pain that way. If they do not have pain that way, then you're also going to press down on the hips to see if maybe we have some form of hip injury. Okay. Now we're going to move to the extremities. Okay. Again, we're going to look for dots. Okay. We're going to look for all of those 4 things. Okay, but you're also going to be looking for circulation, sensation, and movement in those extremities. Okay, so what you would do to check for circulation, as you see this individual here, you would start with each extremity and you would gently but firmly press down all the way down the leg. Obviously, you would do this on the arm as well for all 4 of the extremities to check for circulation. Okay. Then we would be going, sorry, trying to get my notes here. Okay, you could, for other areas to check for circulation, you could also, in your arms, check your radial side. So remember our thumb side for the pulse. If you're checking for pulse and circulation in your legs, you can check on the posterior tibial pulse, which is behind the ankle bone, which is going to be on the medial side of your ankle, your malleolus right here, which is that ankle bone that sticks out. Okay, sensation, we're going to be pinching the ends of fingers and toes, things along those lines. Okay, you're going to, and then you're going to ask the individual if they actually feel you pinching the fingers and the toes. Okay, again, you don't want the individual to look so they know what you're doing. Make sure you ask them to look away and to see if they can actually feel that movement. Okay, and then at the end, the last thing you can ask them to do is obviously wiggle their fingers and toes to see if there is movement in their extremities. Okay, once we have done that, we're going to also check the individual's back. However, you need to make sure that you're not suspecting of a spinal injury. Remember, if we have a spinal injury, we are not moving that individual, we are leaving them. If you do not suspect a spinal injury, you may move the individual to their side. Okay, once you've turned them over on one side, you can inspect the back there. Then you can gently roll the individual back to the other side and inspect the other side of their back. Okay, special considerations to consider and other things that we can do. A capillary refill test. Okay, this is going to be testing for circulation, oxygen, things of that nature. You can see here this individual is pressing the fingernail. Obviously there's no picture of a toe, but you can also do the toenail for a few seconds and to release. Okay, this will help you look at things we're looking for oxygen, and if you can see the color coming back in it, that's going to indicate circulation, oxygen, things of that nature. Okay. Exposing an injury. Okay. So once you have gotten to this part and you might need to expose an injury, you're still trying to figure out what is wrong with that individual. Before you expose an injury, you need to make sure you let the individual know what they are doing. Okay. All of these things that you are doing are very hands-on the individual, and that individual needs to be made to feel comfortable. Okay. It may feel intrusive at times, so you need to make sure that you help this person to remain calm and let him know everything that you are doing. Obviously, throughout this entire process, you need to make sure that you are maintaining privacy. In order to expose um, some injuries, you may have to see, if you see this woman right here, she is cutting the pants, obviously, because let's see, maybe it's a knee injury. She's going to need to cut the pants in order to remove that section of clothing to see if that is what, to see if the individual really does have a knee injury. Okay. Obviously, if you do something like this, please be cognizant and be respectful of that individual, maintain their privacy, and also you need to prevent cold exposure. If you're going to do this and remove a set of clothing, and obviously we are waiting for EMS to arrive, you're going to need to cover that individual up again just to make sure that we don't expose them to the cold. Okay. There are special considerations for you guys. Oh, sorry, hold on a second. Special considerations to think about, some other ones. So you're going to want to check for medical tags and identification tags. Okay, so if you can see, these are two examples right here. This is a medical alert tag. It'll obviously tell you what the medical alert is, and this is a do not resuscitate tag for EMS in case someone does go into cardiac arrest and need to be resuscitated. Obviously, this individual, their wishes are to not be resuscitated. So places that you can look for these objects are obviously a wallet, a purse, necklace, and then also bracelets. So you're going to have to make sure that you check these areas just to see if they have special considerations or special illnesses and things of that nature. Okay. Sample history. You guys are going to want to make sure that you memorize all of these things down here. Okay. So it's going to help you identify what is wrong with the person. So your sample history is the last thing that you are going to do. Okay. It can indicate what first aid is actually needed for this person. So if we go to S, obviously we're using this acronym SAMPLE here. It stands for signs and symptoms. Okay. So what is wrong? Where does it hurt? Okay. You're going to be asking this individual so you know how to go about this. A stands for allergies. Okay. So are they allergic to anything? So if we're thinking something along the lines of nut allergies, okay, then maybe they can tell you, yes, I ate some nuts, I had some almonds, peanuts, anything like that, then you know that they're having an allergic reaction. Okay. Another thing to look for, M stands for medications. Okay. We want to ask the person if they're taking any prescriptions or non-prescription medication. What are they used for? They could be having a reaction to the medication. Maybe they didn't take their medication. They need their medication. Okay. P stands for pertinent past medical history. So what happened in the past that is very pertinent for them? So have you had this condition before, what they're going through? Have you had recent medical conditions? Okay. Maybe someone was sick, low blood sugar, maybe they're diabetic, things of that nature. Okay. L stands for last oral intake. So when did you last eat or drink anything? What was it? How much was it? Maybe they ingested some sort of poison. Maybe they ingested something that they might be allergic to. You need to know what they drank, what they ate, what it was, and how much they had it, and when they took it. Okay. And the last one, E, stands for events leading up to illness or injury. So injury, how did you get hurt? Okay. If the individual can tell you how they got hurt, that helps you out. Illness, what led to this condition? Okay. So these are all things that you will need to think about, and you will need to ask the individual that is either injured or ill. Okay. After we've gone through all of this today, we're going to go through one more thing, which is called the recovery position. Okay. This might seem a little not daunting, but you might not entirely understand how to put someone in the recovery position. Okay. We will again go over this when we have our in-class stuff that we need to do. You guys will all actually have to put someone in the recovery position and know how to explain to me how you do it and actually know how to do it. So putting someone in a recovery position, whether they are unresponsive, okay, but breathing, or they're responsive, okay. Most people, in most cases, should not be moved, okay. If they're ill or something like that, maybe you should move them into the recovery position. If you have Obviously, a spinal injury, you are not moving anyone. If somebody is gravely injured and moving them is going to cause more harm, you are not going to move them. However, there are exceptions to this rule. Is the location unsafe? If the location is unsafe and you need to move the person, this is when you would move them. Or is a person face down but needs CPR? Okay, if the person is face down and you realize that they are unresponsive and they're not breathing, you need to turn them over so you can perform CPR. Okay, so there are several reasons to use the recovery position. So a person is unresponsive, but they're breathing. And we will go into why you put these people into recovery position.